Hello, everyone. I am Dr. Viral Shah. I'm a professor of medicine in Division of Endocrinology and Metabolism at the Indiana University. And I also direct Diabetes Clinical Research Program at IU Center for Diabetes and Metabolic Diseases, again at Indiana University in School of Medicine. It is so my pleasure to have Anna Crosby here with me. She is living with type 1 diabetes for a long time, and I'm so appreciative of her time that she came here today to share her journey of diabetes and how automated insulin delivery system diabetes technologies can help an individual managing diabetes. So with that, I would like to start conversation with Miss Anna. And again, Miss Crosby, thank you so much for having here.
Thank you for allowing me to join.
Yeah. So can you tell us something more about, when did you diagnose with type 1 diabetes? What was that initial reaction and journey looked like?
I was actually diagnosed in 2006 as a type 2 diabetic. Fast forward till probably, 2016. And I still wasn't feeling well. I went to my regular primary care doctor and I said, hey, I'm not feeling well. I, again, done some self-research and found out that there's a test called a C-peptide test. And that kind of tells you whether you're a type 1 or type 2. Well, it came back that I was a type 1.
So thank you, Anna, for sharing your story. And so sorry to hear about that initial diagnosis of type 2 diabetes. And then after a while, it was realized that it was not type 2 diabetes. And this is a story that it's an unfortunate, but I hear that a lot, how difficult it was to manage your type 1 diabetes with multiple daily injections. Can you share something about that?
Well, honestly, it was overwhelming taking all the injections and trying to keep track of everything.
I understand that managing type 1 diabetes with multiple daily injection can be a daunting task. When did you have a conversation about insulin pump with your provider? And I also want to hear from you that did you start that conversation or the conversation was brought by the healthcare team?
Actually, it was brought to him on my very first visit because I'm assuming as providers, see patients day in and day out how exhausted they are by multiple injections. So he handed me all the paperwork on the insulin pump. And he said, I don't want you to make a decision right now. I want you to go home and read the material and see if it fits your lifestyle, see if it's something you want to try. At first I was kind of shy about it because I didn't just the whole body self-image, something being attached to you. It's like, what are people going to think? I'm going to get a ton of questions. And that was my fear and anxiety. But I'm like, I get rid of all these shots. I don't have that anxiety. So I'm like, it's worth it. Let's do it. And so he got me set up with a rep and it was all him. And he wasn't pushing it. He was just saying, here's your options, which is great.
No, that's a wonderful to hear that you were being provided with a pump option at the time. And what I heard is that initially there was some reluctancy of using some kind of a device that will be attached to your body. And as a provider, I do hear that from a lot of my patients as well. And when you started using your pump, what was your feeling after that?
Initially, I kind of had worries, like with the infusion set, the cord, and what am I going to do with this thing? Where do I put this thing? Where do I even, where can I put it discreetly where it's not, visible for others to see? Once I got comfortable with it, it's like a kid on my hip. I mean, I'm used to it, and it's not. After I got over those humps and the newness of it, it was so much better than the injections. A lot of people ask me, well, what's that? Why do you got to have that? And I don't even think about it anymore. I just say it. I don't have to worry about carrying the insulin and the needles and all the things. It's just part of me. It's who I am now. I've actually grown to realize it's okay. That's who I am. I wasn't, chosen for this life. It's just who I am, and it's the way it's going to be.
That's where I felt like this is a message to both the peers, the individuals living with type 1 diabetes, as well as the providers who are seeing patients with type 1 diabetes, is that sometimes the perception of having those devices being a disruptive in your day-to-day life, that perception versus the reality may be different. And sometimes you don't know unless you try it. And so that's exactly what happened in your case. And I that initially you were like, I'm not sure. But once you started using it, you're like, okay, I'm into this, right? This is much better than doing injections. What was that first pump? If you remember, what company and what type of technology was it?
It was the Tandem T Slim is what I started with. Initially, actually, I started before that was ruled out. And then once it was ruled out, my provider mentioned it. He stays in contact with his Tandem rep, and they let him know when new updates come out. And he's like, Anna, you're the first one I thought of. Can you be my first patient? Can we try it on you? I'm like, sure, absolutely. So I was one of his first patients to try it out. And I want to say maybe it's just a few months that I had the pump prior to that. But Control IQ was absolutely another game changer for me as well.
So what did you notice from that Tandem X2 pump as a pump alone? We call a more as a sensor augmented pump therapy in medical literature, to moving to that Control IQ, which is an automated insulin delivery system. What were the changes you noticed and how it changed your life? I want to hear more about that.
Another struggle or obstacle that I was dealing with is the whole carb counting and, dealing with your emotions and different things that play into diabetes. You could have the same meal 2 nights in a row. Everything's identical. And you put in the same amount of carbs and, you know, one night it took care of it. The next night it's like, nope, either you take out or you go too high. Whereas that Control IQ is like thinking for you. If you don't make that perfect carb ratio in there for it, it's like, hey, I got you. Either it takes you down or it says, hey, you're going to go low, eat some food. And so it takes the mental stress off of you as a diabetic. And you have a lot. Like you said, diabetes is 24/7, 365 days a year. You never get a break from it. So having a device just take one obstacle off of your brain or off of your plate was such a relief.
Yeah, that's what I hear from most of my patients as well. Nothing is curing type 1 diabetes, but at the same time, it gives you a really an a good glycemic control as well as the quality of life by taking away a lot of decisions that you have to make by yourself, right? And so I am curious to know, Anna, that after that starting a Control IQ, what happened to your A1C? What happened to your time in range, which is 70 to 180 milligram per deciliter, which most people should spend that time in range. So I'm curious to hear your journey from that pump to Control IQ and how it changed those outcomes.
With it, I became 6.1 was my A1C. It actually kept me right in that range. Gosh, I want to say for ever since I've started with the Control IQ, I've not varied much. I think maybe one of my higher moments was like 6.7, and that's because I went to Jamaica and got married and ate a few things that I wasn't supposed to eat. But other than that, it has really kept me around the 6.1 range.
Wow, that's an excellent control, I would say, because American Diabetes Association recommends to have an A1C of less than 7% without hypoglycemia. So having a 6.1, that's I agree with you that you use that word game changer. I think that was a really great technology to help you to get there. But now you are using Tandem Mobi. And I am wondering that what made you say that, hey, this is working pretty good. It's a darn good technology, Control IQ with the X2 pump. Why do you want to change to Mobi?
I had joined a Facebook group for the Mobi and just kind of watching people's comments and how they were, talking about it and how awesome it was. And I was doing a lot of research and I was debating between it and another device. And what really got me was my tandem rep. Both of them have been very, very good to me. They text me, how are you doing? How are you transitioning? How can we help? They work with me, my doctor, and they provide the best care. And I'm like, I really can't get away from the tandem family. They have just been really good to me. So then I get the tandem pump and I'm like, why did I ever not just do it? I mean, just the heaviness of between the two, it's like a little matchbox. Like I don't even feel like it's a part of, I mean, it's just there. Like I don't have to deal with it as much as I feel like with the Tandem T Slim. Like it's a lot heavier, it's harder to conceal. especially being a woman, if you have to go to a lot of business functions and it's like, okay, where am I going to hide this thing where everybody can't see it? And another game changer that they rolled out, which I'm not sure how long ago, was the remote bolus. That was another awesome feature that they, because if you're in an event, you don't have to worry about trying to find your pump in a dress and try to give yourself insulin. You just literally grab your phone, which most people have, and remote bolus. And with the Mobi, it's the same thing. It's all on your phone. So it's right there at your fingertips. Most people carry their phone around all the time. So it's just right there. It's very convenient, very light, a lot easier. The whole cartridge thing. Did I get in the cartridge? Did I get all the air out of the Tandem T Slim cartridge? And the expense of just those added pieces, whereas in the Mobi, you don't have all that. You literally stick the vial in, draw up, your insulin, pop it on. It was easy, hands down easy. Even if I didn't do the learning, I could probably have figured it out. It seems very easy to work compared to the Tandem T Slim.
Yeah, great. And also, I like that word that you use. It's like a matchbox. It's like such a small device that you can fill it.
Yeah.
I have never heard this word before, matchbox. I'm going to call it matchbox now, with very little tubing. That's awesome. I'm also wondering that were you trained remotely or you were trained in person in a clinic when you transitioned from that X2 pump to Mobi?
I done the online training is what I did.
How much time it took to do that online training?
Oh gosh, not very long at all. Maybe an hour, if that.
Okay, so I think that's another message that the training and nowadays do not take much time, can be done remotely. And in the past, before COVID era, we used to do all the training in clinic in person. And now we learned a lot about how to deliver a virtual care, do a virtual training. And I think you did that virtual and it worked very well, right?
Absolutely.
Yeah. So I heard a lot good things about Mobi and how Mobi has changed some quality of life for you without compromising any control IQ automated insulin delivery technique or the glycemic outcome. Is there any uh, concern or issue or anything that you think that I wish that could have been in a Mobi?
Just the G7. I look forward to the G7 rolling out because with G6, the 2 hour warm up time, minutes are important in a diabetic's life, especially type 1, let alone 2 hours. That's a long time. So I'm looking forward to the 30-minute warm up of the G7. So other than that, I don't have any issues. I can tell you that when I was thinking about transitioning from the T Slim to the Mobi, I had a lot of alarm fatigue. I'm not gonna lie. I'm like, would this thing just stop? I'm so sick of hearing it, and I knew it was doing its job. I get that, but it is just so exhausting. Oh, you got to beep for that, or a vibrate for this, or it's like, what does it want from me now? And it was so real to the point of exhaustion in the middle of the night or whatever. But with the Mobi, I don't have that. I worked with my tandem rep, and she taught me the important alarms to have on to warn you whenever you needed to warn and shut off all those other things that can be shut off. There's only one other thing that the Tandem T Slim had that I wish that Mobi had is, let's say I'm getting in the shower or going somewhere, going to the beach, getting in the ocean. I wish it had that. I think it was like a 1 hour timer or something. It gave you like a time limit. So it's not constantly beeping or saying whatever. But it was like after a certain amount of time, it said, hey, don't forget about me. I'm off. Whereas the Mobi, I want to say it's like every 5 to 15 minutes. It's like, hey, you forgot about me. I'm here, and it's buzzing or alarming to let you know. And it's like, well, there goes my battery. I'm sure it's draining my battery by alerting me and I know you're off, but give me a time frame. Like, I think you had like 2 or 3 different options, maybe 15, 30, or an hour, I think, on the Tandem P Slim. Whereas the Mobi, you don't have that. Honestly, I've just learned to deal with it, but that option would be awesome to have on the Mobi as well.
Yeah, and again, I think what I'm hearing from you, and is we know that nothing is perfect, and so there is always a constant room for an improvement. And I'm sure both Tandem and Dexcom are hearing you, and G7 is coming pretty soon with T-Mobi. So I think you can utilize G7 in near future, very shortly. Yeah, some of the features that you mentioned about the alert fatigue, I think that's a real in people with type 1 diabetes. And I think there are multiple options that providers and patient can try to see what works the best by doing some trial and error on changing settings and other things. But great. So I am very impressed with you being your advocate in this entire journey from a misdiagnosis of type 2 diabetes initially to now type 1, then using multiple daily injections to pump to control IQ to now tandem Mobi with control IQ. So that's a great that you have really overcome many obstacles in that journey and done really good job with the A1C of 6.1. That's pretty impressive. If I ask you to give any message to healthcare provider on how we should be doing or we should be doing a better job of having our patients managing their diabetes. So what would be your advice to us?
My first and foremost advice would be to consider the mental health of the type 1 diabetic. I get it. We're all about numbers. We want our numbers to be perfect. But at the same time, we're human and we live it 24/7. So we're going to have days that we don't care. I'll just be honest with you. We give up. And that's okay because the next day we're right back on the horse and we're doing it again. Just keep encouraging us, keep us letting us know. And like I said, joining those community forums and, getting that outside support as well, surrounding yourself. But as far as endocrinologists and physicians, just supporting your patients and listen. Like you said, it's not a one size fits all. It's, hey, here's the guidelines. We just got to do the best we can do. I know that there's a lot that plays into it: emotions, stress, hormones, all different kinds of things. At the end of the day, just look at the overall picture, not just our numbers.
I can't agree more. And I think as a provider, we need to do a better job about thinking in all different facets of, managing diabetes. That includes the human aspect, the mental health. If I ask you, what would be the message to your peers who are living with type 1 diabetes? What would that message be for them?
Don't give up. It is a struggle. And like I said, get yourself a good support system because you're going to need it. You're going to wholeheartedly need it because it's there till the day you die. And it's an exhausting journey. And it's a very long, hard mental health journey as well as physical. So get a very good support system in place and reach out if you need help or have problems, and like I said, you're going to have bad days. You're going to have off days, but don't just quit at that point. Get up and next day just get at it and do it again.
Yeah, agree. If I ask you in a slightly different way, that if all people with type 1 diabetes, those who are going to watch this, what's your message about technology in managing diabetes?
Well, the short amount of time that I've been on the pump, gosh, what, 5 years? 5 years. In 5 years, let's just talk about it. I went from the regular tandem T-Slim pump. We've rolled out Control IQ. We've rolled out Remote Bolus. We've rolled out G7 and now Mobi. Change is happening. It's for the better. Hopefully, and I see it coming, that our life will become easier and it'll be easier to manage and work with our providers and others to get the support we need and the technology we need to get a break because it is so exhausting.
Again, I agree that technologies really helps a lot in improving quality of life, making diabetes management slightly easier. And so technology can really help in doing better with less effort. So I think your message very crystal clear to our community. And so thank you so much. And I really appreciate your time coming, talking to us, highlighting your journey with type 1 diabetes, use of technologies, and how it transforms diabetes management. So at the very end, I just want to say that number one, technology helps the American Diabetes Association standard of care. Continuous glucose monitoring and automated insulin delivery systems are the standards of care in managing type 1 diabetes. And I'm emphasizing the word standards of care. I think everyone with type 1 should offer and technology. Now it's up to an individual with type 1 diabetes whether it's going to suit their lifestyle or not. But I think as a provider, our job should be giving them an option, giving them all the information that is required, so that they can select the best technology that is going to work for them. And we have a lot of options now in the market, and having a more options, it's good because I think one size do not fit all. So I think the automated insulin delivery, it's a game changer in type 1 diabetes care. Tandem Control IQ, number of studies, real world data suggests that it improves glycemic outcome as well as the quality of life. And so having that kind of a short tube also helps individual in adopting those technologies, using that technologies on a day-to-day life. Again, having those different options would help people to use that technology, to integrate those technologies in managing diabetes. Thank you so much, everyone, for listening, watching this video, and I hope you enjoyed my conversation with Anna Crosby. Again, thank you so much, Anna, for sharing your story here on this stage. Thank you.
Thank you.